Dr. Rex Anderson is a board-certified neurologist who has been practicing neurology in the Dallas, Texas area for over 30 years. But a number of years ago, he decided to focus on the aging process itself, not only diseases of aging, but why do some people age faster than other people? And what could he do as a neurologist and a physician to begin to slow down the aging process? And I had a chance to interview him in Dallas a while back, and I just found it not only fascinating, but exciting to hear how he is now using Max GXL. In fact, I was surprised to hear that he will not take on any new clients or patients unless they first agree to take Max GXL on a regular basis. Here's my interview with Dr. Anderson. Dr. Rex, thanks for joining us today.
Okay, thanks for having me here.
Just tell me a little bit about your background and how you ended up in this thing you're calling age management.
Well, the neurology, as any other doctor does, you see a lot of patients just going down here in front of you really can't touch, whether you're specialty or not. One is they're just getting worse and worse, and you see people around you are getting worse and worse. They don't have a disease process as such, but what they do have is a lessening their ability to do things, lessening performance. You know, that the mountain climbing goes away, and the bicycling goes away, the golf clubs go away, and these racks go away, and finally they don't do very much. They're not sick, but they're just not doing very much. So you know there's something going on with everybody in a case like that. Not just one or two people, but everybody does that. It's a universal commonality when that happens. So in about 1990, I saw the articles that came out by Dr. Rudman, Daniel Rudman, who talked about growth hormone. I figured there's probably going to be a practice here someplace that keeps people healthy, it's wellness-based, it's proactive, actually keeps people healthy so they don't develop the disease of aging. Now the thing that, as a neurologist, I worry about is Alzheimer's and ALS and strokes and things like that, as well as heart attacks and vascular disease. And so these are all diseases of aging. You don't see those before about 40. When you do, it's really pretty rare. So these are diseases of aging. And so what's aging? Aging is just pathological process. It's a series of things which come along, which gradually break down defenses, about after 40, about the damage is ahead of the repair cycle. The repair no longer can take place as fast as the damage takes place, and you go downhill slowly but inevitably. So as it turned out over the next decade, approximately from 1990 to about 2000, it became a specialty of optimal balance of hormones. And what you find out is once you put the hormones back in like they were before 40, then the patient gets very, very healthy again. But it takes a good, healthy eating program, a good regular exercise program, not extreme, but regular, and your hormones. With those in place, patients do very, very well. They go back to where they were and they stay there.
Wow.
And they remain healthy. And genetically, we can live a long time. We can live well. But the important thing is quality of life, how well you live. And health is not the absence of disease. Health is performance. Just because you're not sick doesn't mean you're not having problems. But performance, we measure performance. And when we find people declining in performances after 40, we can put them back up on top again.
Wow, wow. Now, how did you hear about Max? And tell me about how Max came into your life and into your practice.
Dr. Keller was going to come speak at his conference. I've got to get together with him. He knows a lot about glutathione. It's really a great substance. So a couple of nights before the conference, I looked on the net. I said, I've got to have some of this stuff. Saw the research, saw the science behind it, so I signed up. I came to the conference, and actually you were there, and I met you there. And so from there on, my interest in Max and Max GXL really came on. And I've seen the science. I see what's happening with my patients. Actually, with every patient I have on Max GXL, because I know if you can nourish the cell, if you can make the mitochondria more healthy, so they make more energy all the time, the other processes keep up. And what I do, the medications that I use are going to get better and actually do better with my patients. They utilize them better if they have maximum cellular energy. And therefore, when that happens, my patients stay better. Cool. So it really does great things for them.
Am I understanding right that you said that you put all of your patients now on Max?
I do. I'll slow down a bit. I'm glad you mentioned that. My nerves should throw something at me. But really, I put everyone I have on Max. I explain to them the science. I explain to them what it does for them. And I say, this is something you've got to go on because health comes cellularly, energy produced by the cells. And if they're all producing maximum energy, that means you're going to do better. Right. And they do.
Now, tell me what that means. We get it into the cell begins to manufacture more glutathione. What happens next?
Basically, that's basic support for the cell structure. If the mitochondria, the millions of mitochondria inside the cell that make the energy in the form of something called ATP. When you make more ATP, then the cell does more things, And so glutathione, since it's declining after about 20 actually, once you put it back in, the cell makes more energy that can do what it's supposed to do. From the immune system on up. Immune system, strength, endurance, just performance. And performance, as I say, health is performance. It's not just the absence of disease processes.
Now, when you started on GXL, what did you personally notice?
The increased energy, actually, when I started, probably about 2-3 weeks prior to starting on Max GXL, I started that, and then I started an exercise program about an hour, 2 or 3 times a week with my trainer. I hadn't done that for a long time, and I figured I wouldn't be able to get out of bed the next morning. I never had a stiff day or a sore day.
Wow.
Given it to patients, they've done very well with it. Endurance goes up, energy level goes up, aches and pains tend to kind of go away since it's the body's major anti-inflammatory agent. It's just basic cellular support for every cell in your body.
Right.
And so that's what makes the difference as far as I'm concerned. If I can make that happen to my patients, they're going to get better. They utilize my medications better. They're going to stay healthy for a long time.
Terrific. Well, thank you so much for taking
Thank you very
time.
much.
I appreciate you so much,
Sure.
and we'll be seeing you soon.